Other question is Epic, which is the medical record system, which is, I believe, slowly taking over the world. But they have a lot of great things in the system itself. There's a lot of data analysis features and data that's collected automatically, and it can be de-identified. Is that a group that you're particularly working with to kind of do all of the things that you're talking about?
The short answer is yes. And we had our senior data teams, not just at CDC, but across HHS, on the Epic campus to talk about, again, aligned priorities. So not just to say, here's what I'm doing, here's what you're doing, but like, how do we solve some problems together? And we started, not surprisingly, with a couple of vaccine efforts related to what we're doing. And so actually, you may see some new features through Epic, if you all are Epic users, related to vaccinations in the workflow, both to prompt more vaccine signals when folks are due for having gotten vaccines, but also to allow for aggregated de-identified data sharing as